Hi, I'm Dr. John Young, medical doctor.
Hi, I'm Alex, I'm a nurse practitioner, and today we're going to be talking about thyroid hormones. And I have a tricky question for you, Dr. Young.
Yes.
I had a patient the other day that comes in, she's very tired, she's losing her hair, and her cholesterol was very high. So she was tested, and they test her thyroid hormones, but they only tested her TSH. The TSH was normal. So what do you think?
I'm going to get in trouble by the endocrinologist. Here's my thing. Years ago, there was, it was just getting to be expensive to test all the thyroid hormones. And so they developed a test called TSH, Thyroid Supersensitive Hormone Test. And they said, this test will tell you if you need to go further. And if it's within a certain range, they're fine. And we probably get more patients from endocrinologists than any other group of people. They don't do it on purpose because people come into us saying, I went to my endocrinologist, he says my thyroid is fine, my hair is falling out, it's thinning, I have no energy, my skin is terrible, I'm gaining weight, and I'm a little bit depressed. And he just says, well, maybe take some Prozac and get used to it. So I will do this. I will order, and let's say that they aren't on anything.
Okay.
I will order, I already have the TSH, I will order a total T4.
Okay.
I will order a free T3, which is the actual thyroid hormone.
Oh.
And that's where I will start.
We'll start with that.
If there's a question about autoimmune diseases and so on, I might order thyroid antibody tests for if you have a lot of antibodies, you may have Hashimoto's thyroiditis. But that's where I start. And then
do you find that the TSH doesn't quite match? Is that what you find in your patients? It doesn't give you the whole picture, the whole information?
It's so interesting. I will, once we kind of identify it, now I will tell them, listen, I'm going to make some adjustments. Your TSH is going to not be where your endocrinologist wants it.
Listen to it.
So you need to tell me, do you want me to get you to a number, or do you want me to get you so you feel better?
Yes.
And it's been 100%. They all want to feel better.
Yes, that's what I get, the feedback that I get too. But I think my concern is that we have seen this in practice where we test the TSH, which is the standard guideline for all the medical doctors, and we test that, and usually that's within range, and then all of a sudden we have those patients where we test the T3 free, and it's very, very low.
Right.
They've been running low thyroid, even though their TSH numbers are fine. Those are the patients that I'm concerned about.
Right. So, and there's more and more studies coming out that saying TSH is not the great end all be all. So what I will do is I will say, you may want to consider thyroid hormone, but first, if they don't want to do that, I will actually put them on Lugol solution or iodine, because iodine helps turn T4 in the thyroid into free T3, which is the actual thyroid hormone. And most Americans are low on iodine anyways. If you take in too much iodine, you just excrete it in your urine.
Yes.
So
and also we always testing. We are testing the patients with blood work. So
I will start them there. If they are saying, it really didn't help or helped a little bit, then I will say you may want to consider thyroid replacement. Now, there's the pharmaceutical, and there's the bioidentical replacement. The pharmaceutical, I don't have problems with. I think if people have gluten intolerance, that there's gluten in the synthroids, the levothyroxines, and all of that, you may not want to go there. There's some other things in it I don't like, but it's not my way or the highway.
Yes.
For most of our patients, we end up putting them on, I'm not pushing anybody, but I mean, Armour Thyroid, NP Thyroid, Nature Thyroid,
Because I think we go very much with the results, the testing that we do, along with what the patient feels, what kind of reactions we have.
Start low.
Start low.
And then I bring them back in about 6 weeks. I'm one of those that I want to feel good pretty quick. And so I know a lot of doctors will wait 6 months. In about 4 to 6 weeks, that level, if you made an adjustment, is going to be right about where it should be. And so I will come and see them again. I will look at the numbers, and then I will talk to them. And we'll adjust. And I've had people say, John, I feel great. And, things are just turning around. And it's very interesting. In a lot of the thyroid labs, normal maybe 2.0 to 4.2.
Right.
And they may be at 2.6.
Yes.
They're doing fine.
Yes.
Some others, I have to get it up to 4.0 or 3.9 before they even notice anything. So you look at the number, but you have to actually talk to the patient. And then that's how I adjust to how they're doing.
I hear you. Now, I hear you talk about iodine. Would you advise anybody just go out there and start taking iodine, or you would rather them to get it tested and see you first?
I think, well, there was a study recently that most Americans are low on iodine anyways. And there's so many things in our environment that wipe out iodine. Chlorine, chlorinated water, bromide, saltwater pools here in Florida kill the iodine, bromines and bread products. And so there's things in our environment that really knock out iodine. So
a lot of people we find to be depleted anyways in iodine.
I don't usually check the level because it's a special test. It's 24-hour collection. You just don't draw a blood sample.
Yes.
And I have no problems with them starting it.
Okay.
So, but it's individual.
We have another question because you mentioned about the autoimmune problem as far as the thyroid goes. What if you tested and the patient has antibodies, which means they have an autoimmune thyroiditis, and they have high antibody counts? A lot of people get that confused. They think if they have Hashimoto's, that they need to be on a certain dose and a certain drug. What does that mean? So people differentiate what is Hashimoto's and what it is hypothyroid.
All right. So hypothyroid is just the thyroid just isn't functioning well.
Okay.
Hashimoto's is an autoimmune disease where the body is saying, "Hey, thyroid, you're the enemy. We want to get rid of you." So it's sending antibodies that are actually attacking the thyroid.
The thyroid. Okay.
Like rheumatoid arthritis is, "Hey, this wrist joint, you're the enemy. We're going to attack you."
Okay.
So that's the
I get that question a lot because people get that very confused. So that just means there's probably something that you can do to help your immune system.
Right.
Or your diet.
And a couple of interesting things I'll just say about that quickly. One is all autoimmune patients have the same biochemical defect. They cannot use oils to make energy.
Oh, wow.
And oils become inflammatory, pro-inflammatory. But if you give L-carnitine, amino acid, 1.5 to 3 grams a day, you reverse that. You have to do it for the rest of your life, but it reverses that defect. And it's interesting, a lot of people just get more energy just doing L-carnitine because now you can use oils to make energy. Yes. So I will put them on L-carnitine.
That's one of the things, that's very interesting. So there is something you can do about it.
Right, yes.
That's very helpful.
The other thing a number of doctors are doing is using low-dose naltrexone.
Okay.
Which is a drug, it needs a prescription, that it helps
to regulate.
It modulates the immune system. It helps reduce the antibodies, and I think that's very important.
That's very important that you bring that up because I have heard from patients that they were told that there's nothing they can do about the Hashimoto's. They were told that, no, don't worry about it, there's nothing you can do about that. And you just said 2 things that can be done and it can help them.
Right. I am an MD and that may be good or bad, but we get so tied in as medical doctors into this is the 500 drugs that I have to choose from.
Yeah.
And not everything is going to be corrected by drugs. And L-carnitine is not a drug.
No.
Low-dose naltrexone is a drug, but it's really a knockoff from a major drug that is used at much higher doses And so they don't really know about it. And you know what's sad? Is they aren't even interested in learning about it.
Yes. But fortunately for us, we have Dr. Young to help us. And for today, this is all we have for you. Thanks for watching.